Pancreatitis comes in these three different forms. And this is super important to understand because frequently even my colleagues don't understand the difference between them. And we want to prevent disease progression because we don't want the pancreatitis to go all the way into chronic pancreatitis. So what are the three different forms of pancreatitis? The first one is acute pancreatitis. That basically means that the patient had one episode of pancreatitis. How do we define pancreatitis? Abdominal pain. And if you're a patient or a family member, the abdominal pain, it's not a trivial pain. The abdominal pain, it's a bomb went off inside of my belly, inside of the patient's belly. This is real pain that the patients go to the emergency department because it's constant, it's not going away, and in occasions it's only getting worse. And then in order to make the diagnosis, it's a typical pain that we just spoke, images showing that there's inflammation in the pancreas and elevation of the pancreatic enzymes, amylase and or lipase, 3 times the upper limit of normal. 2 of the 3 makes a diagnosis of acute pancreatitis. So you have a patient with acute pancreatitis, the symptoms completely resolve, they go back to normal, and then they develop another episode of pancreatitis. 2 or more episodes of pancreatitis, it's considered to be recurrent acute. So just to backtrack this idea, if you have a stone, if you have high triglycerides, if you have conditions that we can treat, and by treating them, you're going to prevent what is called disease progression. What do I mean by disease progression? We could have prevented the acute pancreatitis from going into recurrent acute and then even worse into chronic pancreatitis. Because there's a moment that patients have had so many episodes of acute pancreatitis that it's like a boxing match. The pancreas may give away, and then the patient may develop chronic pancreatitis. It doesn't happen all the time. It's usually 1 of every 3 patients may develop chronic pancreatitis, but chronic pancreatitis means that the organ is sick, they have a severe fibrosis, and these patients may develop chronic pain, they can develop diabetes, they develop exocrine insufficiency because they're not making enough insulin, they're not making enough enzymes. What happens if you don't make enough enzymes? Patients develop a malnutrition, they develop vitamin deficiency, among others, vitamin D, and that's why some of these patients develop problems with their bones. But the message that I really want you to remember is that it's really important to make the diagnosis early in the course of the pancreatitis so we can prevent disease progression. We can prevent the patient developing chronic pancreatitis.